What is going on, everybody? It's Mark Cargila, lead faculty and CEO here at Modern Pain Care, where we make you the complete clinician. Coming at you this week with another new format for our podcast. We're going to be talking to one of our coaching and mentoring clinicians. We wanted to talk about coaching and mentoring because it's one of the things that Jared and I are doing more of currently, but also something we think is probably a better direction that we wish we would have went earlier in our career, as far as not chasing the latest certification and different things, because, you know, without a thinking process and application process, we often found those things falling flat. So before we get into the podcast, I want to introduce the person we have on this week, one of our coaching and mentoring clinicians, somebody who's been doing amazing in the program, and we've been so happy to have him in the program. Howard Yan, how are you doing today, sir?
I'm doing well. Thanks for the opportunity to be here.
Can you introduce yourself to the folks, let people know kind of where you're at and kind of your setting and what you're up to?
Absolutely. So I've been out of PT school for 4 years now. So at least where I'm feeling it, just stepping out of that new grad phase, starting to feel like I get my feet underneath me. My background is primarily in outpatient orthopedics, although with the start of the COVID-19 pandemic, I found myself working in a aquatic therapy center, which means initially I found myself a little bit out of my depth with a caseload of clients with a variety of chronic pain complaints, and a large number of clients for whom our center was PT clinic number 3, 4, or 5 after PT had failed to make improvements in their states previously. So that's where I am currently, and it's been a really wonderful growing experience, along with everything else we've all gone through in this 2020, 2021 mess.
Yes, it has been a mess for sure, and yeah, you have a unique setting, especially with kind of the where people have maybe trickled down through the ranks of kind of traditional PT and maybe been through, you know, a lot of different, parts of their journey already, as far as with pain and different things, and then they come to you. So that can be a challenging experience. Can you speak to kind of how that is as a kind of a younger clinician, relatively new out of in the field, and all of a sudden getting patients who are complex and you know, have already failed with people who are probably much more experienced as far as out there, not necessarily great experience, because I can relate to myself having a lot of experience that was repeating bad experience over and over again. But where were you in like the comfort zone with those type of patients, kind of stepping into that role? Was that something you struggled with, or was it something you felt pretty comfortable with out of the gate?
No problems at all, Mark. No, not at all. No, definitely. As a newer clinician, it was terrifying to start working with these clients for whom they don't fit a lot of clinical practice guidelines. When you ask them what has been done for them, you get this mixed response of either, "Oh no, that's exactly what I would have tried," and in some cases, you do get this story of very passive care, or other clinicians just sort of giving up on them, which for someone like myself was both heartbreaking and very, very anxiety provoking. You know, sort of, oh, the onus is on you to fix a problem that you do not have the skills or the experience to fix. I was very fortunate. I'd been already getting really into outgrowing some of the frameworks and habits I'd learned as a student. Getting out of this sort of purely pathomechanical model of pain and patient care and into a more biopsychosocial model. And that's kind of how I started following Mark and Jared on social media, along with a host of others, to try to update my practice. And, that's part of how we led to where we are now.
Yeah, and that's kind of where, again, Jared and I were, talk, and we're like, man, we when we hear the stories of the people we've been working with, it's like, man, we've been there, remember it, maybe not as fondly, just because it's such a destabilizing experience when you come out in the clinic and, you're confident. I remember I was probably overconfident when I came out of school, like, man, I got all of my DP. Well, I wasn't even DPT. I was MSPT when I came out, but you're a freshly minted PT. You feel like, man, I got all the most up-to-date knowledge. I got a leg up on anybody. And then you realize the clinic and the PowerPoints I was given don't line up a lot. Sometimes they do, but man, they don't often. And God, that can be a destabilizing experience. And then, like you said, stepping into a role where you're getting clinicians, or patients, I should say, who've been with clinicians, and shoot, I would have did that. That was something I was taught in school that should have worked, but why isn't it
Hmm.
working with the patients? And that's often the search that people go, like, there's got to be a way to figure this gray, massively muddy, complex world that is the clinic out, so I can kind of navigate things. Where were you, like, clinical process wise, Howard? As far as, like, did you feel like you had a zeroed in process of how to kind of work through these type of complex things, or I always speak to my process was just chucking things at the wall and, like, crossing my fingers and hoping at the end of that session, man, let's hope something good comes out the back end of it. Did you have any more formal processes, or was that kind of your approach going into things?
No, I mean, I think it's very easy to keep griping about how PT school failed us. But I feel very fortunate. Had a good program, and I think the sort of clinical thinking process that, going through your test retest, going through a thorough differential diagnosis, that was helpful. The problems for me were starting more when you can get your diagnosis, you can get your idea of what's going on, even if that idea is non-specific low back pain. uh, the problem is when, like, nothing is working to help it.
Yeah.
You're taking time to test retest, you're trying to do your utmost to make sure you're not repeating the same thing over and over again. That is not helping. But we visit number 8, 9, 10, 11, 12, 19, 20 comes around for this client, and you go, I'm running out of tricks in my bag. And I think for young clinicians, it's one of the fastest contributors to burnout. In addition to unreasonable productivity demands, is having a lot of folks for whom you're out of items in your bag of tricks to do, and nothing is changing.
Yeah. Yeah. Definitely share that story with you as well. As far as, I've shared this with many people, but I was to the point I was applying for DO school. Thank God I didn't go there, because the DO OMM way of things is kind of one of my more
Hmm.
frustrating things currently, as far as some of the pathologizing normal variation. But that's a whole nother podcast that we won't do that here today. But so I'm just curious if you can speak to what your experience has been in the kind of coaching mentoring setting to kind of help you through some of that, because that's commonly the issue, that it's like, yeah, I have a toolbox. I can either run out of tools, or I'm like, where does it fit to this patient? I mean, where has that been for you, as far as, like, what kind of things have been helpful for you in that aspect?
Absolutely. And I think it's important to know, like, I think part of my journey has been very blessed in the sense that I have had multiple mentors. I think it's we get this idea of mentorship, that it's going to be just that you're one clinical director or just your one older therapist in the neighborhood. But it's been very helpful for me to have 2 or 3 individuals that I go to, like, check in every so often, even if it's like every couple of months, just to talk where I'm at, uh, what I'm struggling with in the clinic. Where this program has been tremendously helpful, first of all, is the sort of frequency the meetings occur at. Having a call literally every week, twice a week if you can make it. Unfortunately, my schedule doesn't allow to make both of the weekly calls, although I'd love to. So I am stuck listening to the recordings. uh, but having a weekly check-in to really get specific with what we're talking about has been tremendously helpful, especially in a setting like mine where things trend a little more complex. So quite early on, was able to present cases, get down to that n=1, and really start understanding, hey, here are some tricks in your bag that you've neglected. Um, and then also just to have someone to validate this idea that, like, I think we're at the end of the rope with this person, either, because in their life they're not ready to make the changes needed, or this person is medically just out of our scope of practice and out of our expertise to help.
Yeah. Yeah. I think That is one of the things that we tend to, as clinicians, especially early in your career, you kind of lump the issue on us. It's I'm failing. I'm
Mhm.
not getting this person where they need to be. And granted, we should be pushing, and and I'm dang confident you are, and the vast majority of clinicians we talk to that we're doing our best, and that's all you can do is validate that you have put 100% effort into that equation. And then there's ways, as we've talked about throughout the program with you, as far as how do you know if the patient's there or not. And instead of you trying to like mash a square peg through a round hole, you just recognize that maybe we're not at a point where they're ready to take that step in the journey. You've given every opportunity, you've done the best of your ability to help them move forward. And there are just things that are outside of your treatment room that just aren't there right now currently to get the person to move forward. And planting those seeds
Right.
like we've talked about, and talking about things to where it doesn't mean you're sacrificing your productivity and things like that, but you're because I know there's definitely pressures that students or new grads and professionals face as far as like, well, I really can't just tell them to not come in. They're my supervisor, my productivity, all these different things play into the role. But I think in the grand scheme, you can do that type of thing and keep the patient's best interest at heart, but also keep your schedule efficient for folks that are maybe ready to be there, want to be there, and are ready to make that journey. And it's not that you're brooming people to the curb, but you're just helping people say, hey, maybe it's not right now, but I'm here for you when it is the right time. And maybe here's some people you can work with that can help you get there sooner rather than later. Um,
Absolutely. I think the big thing again as a younger clinician has been having someone to help validate that decision, because it's super easy to be like, what if I miss something? What if if I had just done this particular lift with them instead of that, would that make a big difference in their care? And cognitively, you can generally recognize probably not. But there's been times when I've been talking with Mark and Jared and the other clinicians in the program, and uh, they have had ideas that I hadn't considered. I think that's another important thing about how this has worked is it's not just about two very highly qualified educators working with you, but there's also a community each of these morning calls to bounce ideas off of. You guys are really good about after you give your 50 cents on a topic to open it up to the group and be like, has anyone else seen something like this? And I think some of our most productive conversations have been where the whole team has dogpiled on an issue and contributed their ideas.
Yeah, yeah, and that's one of the things I've enjoyed, and I enjoyed when we've done weekend courses because we're all unique humans, and we're all going to see the
Mm-hmm.
situations we face in the clinic slightly differently because we have a different context that we bring to that clinical scenario. We've had different past experiences, different trainings, and different things. And if you're humble and you go into a situation for always willing to consider other ideas and other thoughts, man, it's an opportunity to learn. And I think Jared and I have really ingrained it in ourselves, but also try to push it that hey, it's not. This isn't the world of the clinic according to the gospel of Jared and Mark. I mean, we're going to tell you what our bias is. We're going to own our biases, and we try to again make things as system agnostic as far as like definitely I have my biases of how I deal with some things, repeated motions type things and some of the manual therapy type things. But I think, there's other people that have different biases that might fit better for that patient in front of you. Like I'm okay with a patient that might respond better to Howard's approach than Mark's approach. That's okay. And I think that's just that person that day, fit better. And that's something we should embrace and celebrate and say, hey, I'm happy you got somebody and not take it as such a personal blow to our clinical ego that it's just there are some people that either the relationship doesn't happen or whatever. But as far as like I've greatly enjoyed that component of the program, kind of just hearing other people's thoughts and hearing other clinicians getting involved in other clinicians' problems because chances are if you're having an issue, another clinician in yours that's on the call is going to have a similar issue and either has experienced it or has some ideas of how they've kind of overcome some of the problems that you bring to the call. So Howard, if somebody's considering something like coaching and mentorship like this, what would be, they're on the fence, they're not sure if it's right or not for them. I mean, what are your advice for somebody who's kind of considering a coaching type program?
Absolutely. I think when you're considering something like this, we're all, the majority of individuals in our field, at least in my limited experience, we're all very hungry to get better at our craft, to figure out how do we help our clients best. So you've already been trying, you've already been, uh, you know, looking through Con Ed courses and so and so's Instagram accounts or blog or whatever resource that you follow. And the wall that we tend to run into is just application and the specific client in front of you. 2, 3 times a week, depending on their care. And so when you decide what, and I'm just going to start very broad, any mentoring coaching setup, it's going to be, hey, does this person have what I think is um, going to be specific to what I need? Whether you have, I think these coaching programs are popping up all over social media, right? People's
Yep.
like exclusive mentorship group, whatever that means. And I think a specific conversation with whoever's going to be providing that, what does that look like? Is this just like hey, I'm going to give a little webinar every week while you guys pay a subscription fee to me? Or are you going to be able to get that individual care, so to speak, that individual coaching? And I think that's something you guys have done a really good job setting up in your program. The idea on these weekly calls, each of us has our own individual slot, and everyone's welcome to listen in and chime in, but that's their time to ask their questions, whether that be specific patient care setup or, I mean, I've had conversations with Mark where it's purely around career direction and my aspirations towards academia. And it's been incredibly helpful to have someone who's walked that path before, has seen other people trying to walk that path, and get a sense of, oh boy, what steps do I need to take to set myself up to go down there? Um, so yeah, if I think specific conversations, and if about does the program you're considering entail, and if they're not going to give you that very individual conversation, if they're not going to be able to tailor their their coaching to the setting right in front of you, uh, I would personally give it a pass. But if you can if you can buckle down, dedicate the time, if you can really get a good sense of what are my needs and what is the program that is going to help me out, these can be tremendously beneficial to your practice, if only to help you identify where are the places I need to upgrade my practice, where are the places that what are the themes as I go through a longer term relationship with these mentors that I need to keep in mind and keep focusing on to level up as a clinician.
Yeah, it's been interesting as we've had discussions with, and had these conversations with our, coaching folks and mentees and things. Jared and I have really enjoyed the clinical thing, but I've also enjoyed, like yourself, with your academia aspirations and different things. We've talked about, many challenging issues that clinicians face. How do you deal with, your fellow clinicians in the clinic who might be much more
Mhm.
experienced and maybe be operating under a narrative that you're having a hard time get behind, and science, most importantly, is having a hard time getting behind some of the traditional narratives that, I once held to. And it's just, it takes time for us to kind of all move forward as a profession. How to document, how to bill. I mean, it's been some different conversations that we had with folks that have been very helpful. That, not just, with Jared and I thought, well, complete clinician, it's all going to be clinical. Well, I think part of being a complete clinician is being able to be efficient in the clinic.
Mhm.
Document, manage your time, have a career direction where you're pointing yourself to expertise. And I think that's a big thing we tried to instill in this program. Here's your process. And you want to involve some Maitland in the process. You want to involve some MDT. You want to involve some cognitive functional therapy. Yeah. Here's a process though that allows you to determine with that tool, how do you determine if it's successful with your patient, and how do you frame it all within this big person-centered care thing that's the big buzzword. But it's one thing to say it, it's one thing to really have a process that gets you there as far as really truly embodying it in what you're doing clinically. So it's been
Yeah, just
very
to add to that.
yeah, go ahead.
Yeah, just to add to that, I think that's been one of the remarkable things about this program is it really hasn't been just about like what happens in the clinic. You guys have even put me in touch with other professionals, almost as another a sort of networking springboard to talk about things. You've put me in touch with individuals in the VA system to talk specifically about how do we cater to some of the psychosocial needs of our veterans. How do we best provide care where there are complicating factors such as service connection to their injuries, and to give me more insight on just what their experience is in the system.
Yeah.
And I thought that was a very cool thing that I don't think you'd see in a lot of other programs. You know, that you take the time to put me in contact with your own contact network.
Yeah, I mean, Jared and I have been fortunate in our development that we've been able to get develop some relationships with a broad array of clinicians. And I am not going to pretend to think that I'm the expert in Veterans Affairs and the unique psychosocial things. I try to own my limitations too, as far as what I'm good at and what I'm not good at. And but that's the beautiful thing. Like we have colleagues like Katie Shopmeyer out in San Francisco, who I think that's who we referred you to.
Absolutely.
I've referred people to Sandy Hilton and Sarah Haig because I am definitely not a pelvic health therapist. I'd try to be able to screen and refer appropriately to the folks that have better skill sets in that. I think yeah, that's been the nice thing as far as to have that kind of referral network to, if it's something I don't feel like Jared, I can plug the hole with, then we need to put you in touch with somebody who can. And I think that's been helpful, not only from a, clinical aspect, but even a career direction. We've had a few folks that are, struggling with their current, situation and looking for maybe some contacts of like, I'm looking to get in a setting where I can thrive and grow and pursue this expertise and be put in a situation where I can really practice at the top of my license and really grow the way I want to grow. So again, we've been fortunate in that aspect. Howard, man, I just wanted to thank you overall for one, your passion for what you do. I think it's been fun to watch. Folks who are coming thirsty, hungry to get good at what they do, and really looking to grow and develop as a PT. I think you're one of the folks that came in early on in the program. We've been greatly impressed with what you're doing clinically and your thought process and again, intellectual humility and humbleness coming in. I think Jared and I try to do that in any setting, including this setting. It's like being open to learn from every opportunity that you encounter, and be okay to be wrong. I think Jared and I regularly are wrong still, and do our best to be less wrong each day. But being open to grow, and you've embodied that, and it's been impressive to watch. Any other things you'd want to leave folks with before we end things off today?
I think I just want to repeat, especially for our more fresh out of school clinicians, something that you alluded to, where it's very easy to start certification chasing when you get fresh out of school. And I think, and it's very easy to, on your initial interview with your job, to say, "Hey, do you guys provide mentoring?" And they say, "Yeah, yeah, 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 yeah." And it turns what they have in mind is, oh, you can just sort of check in anytime you have a clinical question, and they'll answer it in between clients. And I think it's real important for us to take ownership of our own clinical growth and look for opportunities and people that will mentor us, even if that means reaching outside of your immediate network or your immediate clinic to get that help. Uh, and that can look like just someone in your network. That can look like clinicians in the area who are interested in education, or it can look like a program like this. So there's an introspection process that you need to go through and say, hey, what do I need right now? Who can give it to me? And fortunately, there are resources like this around where if you are more isolated for whatever reason, there's still clinicians who care about advancing our field and your practice and can help get you set up for success in the long term.
Yeah, the certification chase is another part of my career that I look back and like, man, probably wasn't the direction, looking back. It just set me up for a very biased way of looking at the world. And again, there's some good thoughts behind some of those trainings and different things. It's just really honing a process first that can allow
Mhm.
you to take certifications on board and put it in a framework to see how you apply it to each unique person you're going to see clinically. And again, I think you're embodying that approach as good as anybody. And for those of you who are listening and like, hey, this sounds like something I might be interested in myself. If you're interested in having a conversation with Jared and I, we're happy to have a conversation with you. If you want to reach out to us, and we're scheduling calls with clinicians who are interested. We've had a great response and have been fortunate to have some great clinicians like Howard and others who've jumped on board. And have been doing very well. So if you're interested, jump on modernpaincare.com/supercharged, and you can have schedule a call with Jared and I, and we'll talk with you and see if it's something good fit. there's some prerequisites that we're really making sure we want folks like Howard who are thirsty, hungry, humble, in to learn, not to lecture each other, and open, and a good community atmosphere where, hey, you can come in and grow and learn from each other, learn from mentors, get held accountable, be okay with some critique. Nothing, I don't think anybody thinks been too harsh with any of our critiques, but that's part of our growth. Mentors aren't there to pat you on your back. Mentors are to kind of point where can you grow and where can you get better, and that's something we try to do with each and every one of our students in the program. So if that's something of interest to you, reach out modernpaincare.com/supercharged, and we'll have a conversation and see if that's something that would be a good fit for us to work with you and help you out. But as we wrap up today, Howard, again, thank you so much for your time this morning. Thank you so much for your trust in us and our program. I've been excited to see your growth and excited to see your future growth. I know you have some big things coming down the pipe with some possible international moves, and also some different things we got trying to set up a good plan for you where you might be away for a year and still growing and getting better. So excited to hear how you grow and go forward. And we will talk to everybody next week. If you have any questions, again, go to the website or else message Jared or I via social media or email, and we're happy to talk with you and help you in any way we can. Until next time.